Hello, I'm Dr. David DeRose, host and executive producer of American Indian Living. I'm here actually in the very studio where we record most of our American Indian Living programming. But I'm here not to record a radio show, but to tell you about an exciting opportunity. This message is especially for health professionals who are working with patients throughout Indian country. We've been given a generous grant to help make a difference with diabetes and high blood pressure in Native communities. What we're doing is we're providing professionals with free resources that they can then share with their patients. Interested? Well, we'll send you those resources if we know that you're planning to use them at least in the next 30 days with just a couple of patients. You say, well, what am I committing to? What kind of resources are we talking about? Great question. I've got them right here. Actually, the first is a book. It's a book that I helped co-author just a couple of years ago, 30 Days to Natural Blood Pressure Control. It's really the foundation for the whole program. It's a great resource. It's actually one of the best-selling books on Amazon in the high blood pressure category, and we'll give it to you free, a couple of copies at least to start with, to share with those two patients that you're going to start using the program with. The book, a lot of people look at it and they say, this is just phenomenal, evidence-based, all kinds of information. But other folks look at some 400-page book and they say, boy, I don't see how I could ever read that. Here's the thing. The book is designed to be a reference source. Some patients will read large portions of it, but others will use it more for the practical chapter conclusions, which include goal setting. So when someone reads about nutrition, for example, I'm looking at that chapter right now, just paging to it. When they look at that chapter on nutrition, it's going to conclude with, guess what? A goal-setting activity where they set some specific goals that they're going to follow for 30 days to improve their nutritional practices. They say, well, how are they going to fill that out if they don't read the chapter on nutrition? Well, that's where the other resources come in. It's largely a DVD-driven program. So we'll give you a set of DVDs that you can then loan out to your patients. Let me show you the centerpiece of the program. It's a DVD series called Reversing Hypertension Naturally. I'm the speaker there for 3 one-hour presentations that go through practical, simple, natural things a person could do to lower their blood pressure. Everything from diet to exercise to stress management is included in these 3 one-hour videos. So these DVDs complement the book, and the DVDs, in reality, are likely going to be the foundation for most patients. But we've got some other resources as well. These actually cover other important topics that complement the material in the book. Actually, one of the early DVDs that we have patients watch is something called Changing Bad Habits for Good. What we find is a lot of people are afraid to make behavior changes. They're afraid it's too difficult, afraid they can't do it. This gives them some of the secrets of making changes and sticking with them. Another ancillary resource that we have makes the Reversing Hypertension program especially relevant to Native Americans and especially to those who have diabetes as well as high blood pressure. It's called Listening to the Buffalo. It begins with the true story of someone who survived a buffalo stampede because of their keen senses. The message is, of course, there are things that we can do to avoid threats around us, not just bison, but also diseases like high blood pressure and diabetes. The DVD talks about traditional native practices that have been used for centuries that can actually make a difference with those metabolic diseases. Really, like I said, complementing the messages in 30 Days to Natural Blood Pressure, the book. The last resource I have allows me to make another important point. If you're not comfortable using any of the resources, you're not forced to use them with your patients, but one that you've got to have in order to do the full program is this resource called Spiritual Health: Neglected Dimensions. It's also a DVD. Now, when it comes to the title track on spiritual health, I know that raises some eyebrows. I'll talk about that in just a minute. But also on this DVD is the first presentation that you want your patients to view. It's one that deals with an overview of the whole program, about a half an hour in length, and then a 10-minute little segue that I give. That is very critical to the program. So you'll want this DVD for that alone. It's actually called the bonus material on this set of resources. But the title track, Spiritual Health, Neglected Dimensions, actually presents an approach to spirituality that I and my co-authors believe transcends spiritual backgrounds. Whether a person is following a traditional native spirituality, whether they're an atheist or agnostic, whether they're a Christian, wherever they're at on that spectrum, this resource attempts to bridge it. Why? Because we look at spiritual practices that are held in esteem across spiritual traditions. For example, the importance of humility, things like being merciful and forgiving. And then we actually look at medical research literature showing how these things can help with metabolic disease, specifically high blood pressure. Well, that's the resources. We'd like to put them in your hands, again, free of charge, if you're planning to use them in the next 30 days with at least 2 patients. That's all we ask. If you do use them then, we actually have some simple forms that we'd love for you to fill out. It's not a requirement, but we're just trying to see the impact of the program. If you go on the compasshealth.net website, compasshealth.net, that's my website, go there under free materials, you'll see seminar guidelines. It will tell you specifically how to run the seminar. In another short video, I actually explain how that works. But also on that DVD is material about a special program where we're actually having a drawing, giving some free things out for people that go through the program. So it gives a little incentive to your patients to use it. But the other thing I wanted to mention that's there on the website is that link to the one-page form that you can fill out. Basically just asks some simple things, hemoglobin A1C, blood pressure, weight, before and after the program. Those are the real essential things we're trying to capture, and then just send that in to us. Just email it right back. We've got all that information. It's found under the category, and I'm looking at the website right before me here, just getting a real good look. It says Seminar Resources and Drawing. Seminar Resources and Drawing. If you go on that link, it's the second item under free materials on the Compass Health website. Well, that's all for now. Hopefully you've enjoyed this glimpse into the American Indian Living radio studios, as well as learning about this free offer. Again, I'm Dr. David DeRose. Hopefully you'll take advantage of it and will make a difference in high blood pressure and diabetes without adding more medications. Thank you.